And now, the Business Experience Show.
Welcome to the Business Experience Show. Today's show is sure to hit the sweet spot. We have dentist Dr. Gregory Vigoren. He is an advocate of better dentistry, healthy practices, and quality living. Welcome, Dr. Vigoren.
It's a pleasure to be here.
How are you doing? You've been in business for 42 years. Can you give us an overview of Vigoren Dental?
Well, I've been practicing dentistry for 42 years. I've been here in Newport for the last 37 years. And overview is I still every day enjoy going to work. And I do multiple other businesses and entities. And it's really about providing quality service or product or ideas. And it's really all very interchangeable.
All right. First, you provide dentistry, right?
Correct.
That's your primary. And then
correct.
Secondary, you provide education referrals outside of dentistry. Can you explain a little bit more about that? Well,
we have a company that makes two products that are oral health issues. I'm on the board of a bank. You can hardly get out of my chair without talking about medical whole health systemic issues because they're all interrelated and so it's hard to cut into compartments. It all overflows.
So you're actually talking about a person's overall health as opposed to, or in addition to talking about their dental health?
Well, dental health, if you live your whole life without dental disease, inflammatory dental disease, periodontal disease, abscess teeth decay, it's well documented. Your life expectancy is 10 years longer.
Well, is that just because people that floss regularly and brush properly also eat better or take better care of themselves?
No, it's because there's a biofilm, a bacteria that lives on teeth. All the rest of the body sheds a layer of dead cells, and it's protected. If you're growing something on your elbow and you don't wash it as a kid, it just falls off. But teeth,
what, the elbow or the bad stuff that's growing on the elbow?
The bad stuff that's growing on the elbow. Okay, but teeth, that surface comes into the mouth. It's why dentistry is unique as a subspecialty of medicine. It's why dental disease is unique. You have these hard surfaces that erupt into the mouth, and the same bugs can live on those surfaces for 80 years.
Right. So I'm interested when you talking about the overall health. When you see a patient that comes in for a teeth cleaning and they've gained weight or they appear pale or something, how do you approach that?
Well, a number of things. First of all, sleep apnea, which is, again, semi-treated with some dental devices, but also referred out for a number of things. Sleep apnea causes weight gain. It causes, if you die in your sleep, there's a very good chance that there was a sleep apnea component. Weight gain and inflammatory disease. Inflammatory disease and diabetes are related. Inflammatory disease and cardiovascular, cerebral vascular, people who have valves or knees or hips. These are all people that are at risk because of dental bacteria that can be controlled.
Sure, and a person is probably more likely to go to a dentist than a cardiologist to be told that there might be a problem or a reason for a stress test or something else.
Well, we generally see people more frequently. We have more time to talk to them. The boring appointment to you is an opportunity for us to talk about anything we want.
Sure, I'll buy that, but I go to the barber every 6 weeks. I'm more frequently in a barber's chair. Why wouldn't that be a more appropriate place for me to get treatment or somebody to talk about my sleep apnea or weight gain?
Well, I can't comment on all dentists, but when I started out 30, 40 years ago, one of my hobbies was to figure out how to live to be 100 healthy. And so you can't learn everything about everything, but the first 2 years of dental school and medical school are virtually identical. The pre-med subjects are identical. And that next 2 years over a 40-year period, if you just go to continuing education on any subject, you can pick up the research, the jargon, the understanding of almost anything. And so I'm not trying to practice medicine, but it all interrelates.
Dr. Vigoren, you've been in business over 42 years. How have you seen business change for you in your practice in dentistry and in business with technology being present now from when you started 42 years ago. What are some major differences you've seen in business?
Well, 42 years ago, I was in dental school working on my family and friends. Okay, and then in 1975, when I came to Southern California, it was primarily word of mouth and word of mouth from your patients that referred in your other patients. Well, just recently, I've had the shock of learning that 80% of patients find their dentist through the internet. And up until a year ago, I didn't even have an internet web page.
Wow.
And if you're not the first one, on your web page, 50% of the people can't find you. And if you're not on the first page, 92% can't find you. And so it's a rude awakening for me that people have changed how they find people.
Right.
Now, but there's one thing that I'd like to say that I found interesting and find interesting with a lot of professional groups. The relationships is really what's built your practice over the years.
Well,
And
I start out with patients, and my goal with everyone is to have a long-term relationship with them and to make decisions that are in their best long-term interest. And so, therefore, a lot of times aesthetics things don't come to the top of the list. The patient may be interested in something, but it's really their systemic health, and we go back to their other health issues and other referrals. But the long-term relationship is really the most important thing from a business standpoint that we try to maintain, and it's about treating people like family, like friends.
And I know that when someone's looking for a dentist, one of the first things is in any industry, you're going to ask for a referral. And I see this all the time. Being on Facebook, some people will say, hey, anyone know of a good dentist? And people will reply. I mean, that's just one element of social media.
Right, but it's the relationship. But now you want to increase your customer base, and that's where you were referring to. You need to be found on the internet very quickly, whether it's Facebook or search engines or aggressive marketing tactics.
Well, and sometimes it's just that there's somebody that's actually looking for you, and they can't find you. If nobody goes to the yellow pages anymore, if I'm looking for you and I don't know how to spell your name, how am I going to find you? And if I do know your name, but I don't know your website, I've got to put in Google some sort of a search, or I know the city that you're
keywords.
in. It's very hard to figure out how to find somebody, even if you're looking for them.
Well, the purpose behind that is, Orange County's grown quite a bit in the last 10 years. So you have a number of people that have moved in that do not have a dentist that's local, so they do a lot of referrals. But if they don't have a referral or know someone, the first thing that they do is they go online and they do some type of search or post on Facebook.
Right, keywords.
Well, more than 90% of our patients come in referred by our existing patients.
Yeah.
And it's something that I realize now that I have to change in philosophy. But the other thing with the dentist is you're limited to the number of patients that you can see or actually treat. So it isn't like we have the capacity to
do an assembly line of
to expand. It may be the difference between adding 10 or 20% more capacity by filling more seats on the plane. The analogy of just having a little bit of extra time.
And it's not just as easy as hiring another hygienist or another dentist, because you have space considerations and equipment considerations as well.
Well, and it might even be philosophy and training. If you're practicing with a specific philosophy and you're doing things in specific manners, the new people coming in might not understand some of those concepts even, or be able to deliver those services at the same with the same outcomes.
So doctor, if you're working at capacity but you want to make more money, you either need to charge more money or sell other products besides your dental services.
Well, pet peeve here is that sometimes dentistry is reimbursed by third parties who do not care at all about outcomes, and when you start using people who do not care about outcomes to set fees, it's inappropriate for outcomes. And so one of the things that I'll always say is we try not to cherry pick procedures, and people come in with a bell-shaped curve of needs, and we try to provide all those, and we try to make all those equally profitable and not have to pick certain high-ticket items to be profitable in the business of dentistry.
Well, one of the things that I know that we've discussed is about the education. You talk about education and training. and you educate your customers about the different types of things that when they come in for dental. It's a long-term process that you begin with. Share some of that information that you shared with us earlier.
Well, it's a personal philosophy, but with my personality, and I have to literally back off on most people because I would scare them out of the chair. Okay, and one of the things I'm trying to do is make people comfortable, and one of the most important things in making people comfortable is you have to want to.
Sure.
And the second thing is that we try to pick and prioritize treatments that are the patient really needs in the order that they really need them, and if we do that, it's very simple to pick out the thing that is most important and do just one thing. And so without telling them about the whole world, we just work on one thing, we photograph it, and then we show the entire sequence of events in a series of photographs that allow the patient to understand what we're doing.